Hey, stop what you're doing right now, because what I'm about to share is some of the most important health education information that adults over 60 need to hear, and I say that not to frighten you, but because most people take their medications without ever being told about certain potential cognitive effects that some research has been exploring for years. Hey, let's talk about information explained by Dr. Eleanor Shaw, who's neurologist, cognitive health specialist. 27 years of experience studying brain health and cognitive function in older adults. He said, I've discovered through reviewing research from multiple major institutions is that there are certain categories of commonly prescribed medications that some research suggests may be associated with cognitive changes in older adults. Now, before we continue, I want to be absolutely clear. This is general educational information only. This is not medical advice. Never stop, reduce, or change any medication without first consulting your qualified healthcare provider. Many of these medications are prescribed for critically important medical reasons. Stopping them without medical supervision can be genuinely dangerous, sometimes life-threatening. What I'm sharing today is information about what some research suggests, so that you can have an informed conversation with your doctor, not so that you can make unilateral decisions about your medications. With that said, this is a conversation that every adult over 60 deserves to have with their healthcare provider. Today I'm going to walk you through 9 categories of commonly used medications that some research suggests may be worth discussing with your doctor regarding their potential cognitive effects in older adults. And I want to tease something right now. Number 1 on this list is a medication that millions of adults over 60 take every single night without ever questioning it. And some research suggests it may be one of the most significant contributors to cognitive changes in older adults. So please watch this to the end. The information builds. Each point connects to the last. But before we begin, I want to ask you something personally. Leave a comment below and tell me this. Have you or someone you love ever noticed cognitive changes that seem to coincide with starting a new medication? I read every single comment, and your answers shape what I cover next. Okay. Let's get into it, starting with number 9. Number 9, antihistamines. Number 9 is something so common, so readily available that most people never think of it as a medication at all. I'm talking about first-generation antihistamines, medications containing diphenhydramine, commonly found in over-the-counter sleep aids, allergy medications, and cold remedies. You know these medications. They're sold under various brand names at every pharmacy and grocery store. Millions of older adults take them regularly for sleep, for allergies, for cold symptoms. But here's what some research suggests about their potential effects on the aging brain. First-generation antihistamines are what researchers call anticholinergic medications. They work by blocking a neurotransmitter called acetylcholine. Now here's why this matters for older adults specifically. Acetylcholine is critically important for memory and cognitive function. It's one of the primary neurotransmitters involved in memory formation and recall. And here's the important detail. Alzheimer's disease is characterized by a significant decline in acetylcholine activity. When you take medications that block acetylcholine, you're essentially mimicking one of the core mechanisms of cognitive decline. In younger adults, this effect is temporary and mild. But in older adults, particularly those over 60, the brain's cholinergic system is already under age-related stress. Adding anticholinergic medications on top of this existing vulnerability may have more significant effects. A landmark study published in JAMA Internal Medicine explored the relationship between cumulative anticholinergic medication use and dementia risk in older adults. The findings were significant enough that they generated substantial discussion in the medical community about anticholinergic burden in older patients. Now, for occasional use, many doctors consider these medications relatively safe. But regular, frequent use, particularly in older adults, is something worth discussing with your healthcare provider. What to discuss with your doctor? Ask whether there are non-anticholinergic alternatives for your sleep or allergy concerns. There are newer generation antihistamines that do not cross the blood-brain barrier as readily, which some research suggests may have a more favorable cognitive profile. Synergy tip for number 9. Keep a simple medication log listing every over-the-counter medication you take regularly, not just prescriptions. Many people don't realize how frequently they're taking antihistamines until they write it down. Bring this log to your next doctor's appointment. That's number 9. But number 8 involves a category of medications that millions of older adults take for a very common and uncomfortable condition. Let's talk about it. Number 8. Bladder medications. Number 8 is a category of medications prescribed for one of the most common conditions affecting older adults: overactive bladder. I'm talking about anticholinergic bladder medications. Medications prescribed to reduce urinary urgency and frequency. These medications are prescribed to millions of older adults. They provide genuine relief from a genuinely uncomfortable condition. This is not a statement against their use, but here's what some research suggests about their potential cognitive effects. Like antihistamines, bladder medications in this category are anticholinergic. They work by blocking the same acetylcholine neurotransmitter that's critically important for memory and cognitive function. And some research suggests that in older adults, particularly those already at risk for cognitive decline, regular use of anticholinergic bladder medications may be associated with cognitive changes over time. A study published in a major neurology journal explored cognitive outcomes in older adults taking anticholinergic bladder medications over several years. The findings raised questions about cumulative anticholinergic burden and cognitive health that the medical community continues to study and debate. The American Geriatric Society includes several anticholinergic bladder medications on what's called the Beers criteria, a list of medications that some research suggests may be potentially inappropriate for older adults due to various risk considerations. Now, many people genuinely need these medications. The discomfort and quality of life impact of overactive bladder is real, and there are situations where the benefit clearly outweighs the potential risk. But some research that there are alternative approaches, both pharmacological and non-pharmacological, that may address bladder issues with potentially less cognitive impact. What to discuss with your doctor? Ask specifically whether your bladder medication is on the Beers criteria list for older adults. Ask whether there are alternative approaches, including pelvic floor therapy, behavioral modifications, or newer medications with potentially different cognitive profiles that might be worth exploring. Synergy tip for number 8. Research suggests that pelvic floor physical therapy can be an effective approach for overactive bladder in some older adults without pharmacological side effects. Ask your doctor whether a referral to a pelvic floor specialist might be appropriate for your situation. Number 8 is significant. But number 7 involves something that millions of adults over 60 take every single day for anxiety and sleep. Let's talk about it. Number 7, benzodiazepines. Number 7 is a category of medications that has been prescribed for decades for anxiety, insomnia, and panic disorders. I'm talking about benzodiazepines, medications like diazepam, lorazepam, and alprazolam, among others. These medications provide genuine relief for genuine conditions. Anxiety and insomnia cause real suffering, and for short-term use in appropriate clinical situations, benzodiazepines have an established role in medicine. But here's what some research suggests about long-term benzodiazepine use in older adults. Some studies have explored associations between long-term benzodiazepine use and cognitive outcomes in older adults. Some research has suggested potential associations between chronic benzodiazepine use and certain cognitive changes in older populations. Additionally, benzodiazepines in older adults are associated with several other concerns that are particularly relevant to this age group, including increased fall risk, daytime sedation, and potential for dependence. The American Geriatric Society includes benzodiazepines on the Beers criteria for potentially inappropriate medication use in older adults, not because they're never appropriate, but because their risk-benefit profile in older adults warrants careful consideration. Some research suggests that cognitive behavioral therapy for insomnia, sometimes called CBTI, may be as effective as medication for sleep issues in some older adults with a potentially more favorable side effect profile. What to discuss with your doctor? If you're over 60 and taking a benzodiazepine regularly, particularly for sleep, ask your doctor specifically about the risk-benefit profile of continued use for your individual situation. Ask whether non-pharmacological alternatives might be appropriate. Never stop benzodiazepines abruptly. This can be dangerous and requires medical supervision. Synergy tip for number 7. Cognitive behavioral therapy for insomnia is now available through trained therapists and even some digital platforms. Some research suggests it may produce durable sleep improvements without medication side effects. Ask your doctor whether this might be appropriate for you. Number 7 is important. But number 6 involves a category of medications used for a condition that affects millions of older adults. And if you're finding this valuable so far, this is a good moment to hit that subscribe button and give this video a like. I release evidence-based health education content for adults over 60 every single week, and your support makes that possible. Number 6. Certain blood pressure medications. Number 6 involves one of the most commonly prescribed categories of medication for older adults, blood pressure medications. Now, blood pressure management is critically important for cardiovascular and brain health. Appropriate blood pressure treatment reduces stroke risk and protects cognitive function. This is not a statement against blood pressure management. But here's where the research becomes nuanced. Some research has explored whether certain specific blood pressure medications, particularly older generation beta blockers and certain diuretics, may be associated with cognitive symptoms in some older adults. Additionally, some research has explored the cognitive effects of overly aggressive blood pressure lowering in older adults, a phenomenon sometimes called hypoperfusion, where blood pressure drops too low and the brain receives insufficient blood flow. Some studies have suggested that in very elderly adults, excessively low blood pressure, sometimes resulting from aggressive treatment, may actually be associated with cognitive concerns rather than protection. The research here is genuinely complex and evolving. Different blood pressure medications have different cognitive profiles, and optimal blood pressure targets for older adults remain an area of active medical discussion. What to discuss with your doctor? Ask whether your current blood pressure medications and targets are appropriate for your age and overall health status. Ask whether your blood pressure is being monitored for episodes of low blood pressure, particularly when standing up, which some research suggests may be worth monitoring in older adults on blood pressure medications. Synergy tip for number 6. Monitor your blood pressure at home, both sitting and standing, and keep a log. Let this log know your doctor. Some research suggests that blood pressure variations, not just average readings, may be worth discussing with your healthcare provider. Number 5. Proton pump inhibitors. Number 5 is a medication category so commonly used that many older adults take it without even remembering why they started. I'm talking about proton pump inhibitors, PPIs, medications commonly prescribed for acid reflux and stomach ulcers. PPIs are among the most commonly prescribed medications worldwide. They provide genuine relief from genuine discomfort, and for specific clinical indications, they have an important role. But here's what some research suggests about long-term PPI use in older adults. Some research has explored associations between long-term PPI use and vitamin B12 deficiency. PPIs reduce stomach acid, and stomach acid is necessary for absorption of vitamin B12 from food. Long-term PPI use may reduce B12 absorption over time. Vitamin B12 deficiency is particularly significant for brain health. B12 is critically important for neurological function. Some research suggests that B12 deficiency in older adults may be associated with cognitive changes and neurological symptoms. Additionally, some research has explored associations between long-term PPI use and magnesium deficiency, another nutrient important for neurological function. Some studies have also explored potential associations between long-term PPI use and certain cognitive outcomes in older adults, though the research is still evolving. What to discuss with your doctor? Ask whether long-term PPI use is still clinically necessary for your specific situation. Ask whether your B12 and magnesium levels are being monitored. Ask whether periodic reassessment of your need for PPI therapy is appropriate. Some research suggests that many patients continue PPIs long after the original indication has resolved. Synergy tip for number 5. Discuss with your doctor about getting your vitamin B12 level measured, particularly if you've been on a PPI for more than a year. Some research suggests that B12 supplementation may be worth considering for older adults on long-term PPI therapy, though this decision should involve your healthcare provider. Number 4. Certain antidepressants. Number 4 involves a category of medications prescribed for one of the most common conditions affecting older adults: depression and anxiety. I'm talking specifically about older generation tricyclic antidepressants and certain other antidepressants with anticholinergic properties. Depression in older adults is a serious, real condition that requires appropriate treatment. This is not a statement against treating depression. Untreated depression in older adults has serious health consequences. But here's what some research suggests about certain specific antidepressant medications in older adults. Some older generation antidepressants, particularly tricyclics, have significant anticholinergic properties. As we discussed earlier, anticholinergic medications block acetylcholine and may affect cognitive function in older adults. The American Geriatric Society Beers criteria includes several tricyclic antidepressants as potentially inappropriate for older adults, not because depression shouldn't be treated, but because there are alternative antidepressants available that may have more favorable cognitive and safety profiles for older patients. Some research has explored whether switching older adults from tricyclic antidepressants to newer generation antidepressants with lower anticholinergic burden might improve cognitive outcomes. What you can discuss with your doctor. If you're over 60 and taking an antidepressant, ask whether your current medication has anticholinergic properties. Ask whether a medication review, potentially switching to a newer generation antidepressant with a different side effect profile, might be appropriate for your situation. Never change or stop antidepressants without medical supervision. Synergy tip for number 4. Ask your doctor to calculate what researchers call your total anticholinergic burden, the combined anticholinergic load from all your medications together. Some research suggests that total anticholinergic burden across all medications may be more clinically significant than any single medication in isolation. Number 3. Certain cholesterol medications. Number 3 involves something that millions of older adults take every evening before bed. I'm talking about statin medications, specifically the potential cognitive effects of statins in some older adults. Now, statins are among the most studied medications in history. For many adults with cardiovascular disease or significant cardiovascular risk, statins provide genuine, evidence-based cardiovascular protection. This is not a blanket statement against statin use, but here's where the research becomes genuinely interesting. Some patients and some researchers have reported and explored potential associations between statin use and cognitive symptoms, including memory problems and cognitive fogginess, in some individuals. The FDA has noted that there have been rare post-marketing reports of cognitive side effects associated with statin use, including memory loss and confusion. However, the research is genuinely complex. Some other studies have suggested that statins may actually have protective effects on cognitive health in certain populations. What the research suggests overall is that statin effects on cognition may vary between individuals, with some people potentially experiencing cognitive symptoms and others potentially experiencing protective effects. What to discuss with your doctor. If you're on a statin and have noticed any cognitive changes since starting, memory issues, brain fog, confusion, discuss this specifically with your doctor. Ask whether a trial period monitoring cognitive symptoms is appropriate. Never stop statins without medical supervision, as this can have serious cardiovascular consequences. Synergy tip for number 3. Keep a simple journal of any cognitive changes you notice, memory lapses, confusion, brain fog, including when they started and whether they correlate with any medication changes. This information is genuinely valuable for your doctor. Number 2. Sleep medications. Number 2 is something that an enormous number of adults over 60 rely on every single night. I'm talking about prescription sleep medications, particularly older generation sedative hypnotic medications, including certain non-benzodiazepine sleep aids that work on similar brain receptors. Sleep is critically important for brain health. Chronic insomnia has real consequences. And many older adults genuinely struggle with sleep. This is not a dismissal of the real suffering that insomnia causes. But here's what some research suggests about regular use of certain prescription sleep medications in older adults. Some sleep medications work by suppressing certain types of brain activity to induce sleep. But some research suggests that the sleep produced by certain sleep medications may differ from natural sleep in important ways, particularly in terms of the deep, restorative sleep stages that are most important for brain health and what researchers call glymphatic clearance, your brain's overnight waste removal system. Some research has explored associations between regular use of certain sleep medications and cognitive outcomes in older adults over time. Additionally, prescription sleep medications in older adults are associated with next-day cognitive impairment, increased fall risk, and potential for dependence, all significant concerns for this age group. I had a patient, Margaret, 70 years old, from Seattle, a retired librarian who had been taking a prescription sleep medication every night for 4 years. She came to me concerned about memory issues that had been gradually worsening. After a careful medication review and discussion with her prescribing physician, she worked with a sleep specialist to gradually transition to non-pharmacological sleep approaches. Over several months, her sleep quality, measured objectively, actually improved, and her cognitive symptoms stabilized. Margaret told me, "I assumed the sleep medication was helping my brain. I didn't realize it might have been working against it." What to discuss with your doctor? Ask specifically whether your sleep medication is appropriate for long-term use in your age group. Ask whether cognitive behavioral therapy for insomnia, CBTI, has been considered as an alternative. Never stop sleep medications abruptly without medical supervision. Synergy tip for number 2. Ask your doctor for a referral to a sleep specialist, not just for medication management, but for a comprehensive evaluation of your sleep architecture. Understanding the quality of your sleep, not just its duration, may provide important information about your brain health. This is number 2, and it is significant. But what I'm about to share for number 1, the medication that millions of older adults take every single night without questioning, this is what the research has been quietly building toward. This is the one. Number 1, anticholinergic medications, the cumulative burden. Number 1 is not a single medication, it is a category. And understanding this category may be the single most important piece of medication education for adults over 60. Number 1 is what researchers call the total anticholinergic burden, the cumulative cognitive load created by multiple anticholinergic medications taken simultaneously. Here's the mechanism. And I want to explain this carefully because it's critically important. Throughout this video, I've mentioned anticholinergic medications multiple times. Antihistamines, bladder medications, certain antidepressants, all anticholinergic. Here's what most people, and even many doctors, don't fully appreciate. Each individual anticholinergic medication may have a modest cognitive effect in isolation. But when you're taking 2, 3, or 4 anticholinergic medications simultaneously, which is common in older adults who are managing multiple conditions, the effects may compound significantly. Your total anticholinergic burden is the sum of all the anticholinergic medications you're taking. And some research suggests that high total anticholinergic burden in older adults may be one of the most significant and most modifiable risk factors for cognitive decline. A major study published in JAMA Internal Medicine followed older adults over several years and explored the relationship between cumulative anticholinergic drug use and dementia diagnosis. The findings were significant enough to generate substantial discussion throughout the medical community about how anticholinergic burden is managed in older patients. Think of it like this. Your brain's acetylcholine system is like a river that powers a city. One small dam upstream has modest effects. But when you build 2, 3, 4 dams simultaneously, each one modest on its own, the combined effect on the city's water supply can be devastating. Each anticholinergic medication is a dam. Your brain's acetylcholine system is the river, and your cognitive function is the city. I had a patient, Thomas, 74 years old, from Boston, a retired professor who came to me with significant memory concerns that had developed over 2 years. When I reviewed his complete medication list, including over-the-counter medications, He was taking 4 different medications with anticholinergic properties: a nighttime antihistamine for sleep, a bladder medication, an older antidepressant, and an over-the-counter cold medication he took regularly. Each medication had been prescribed or recommended for a legitimate reason. No single prescriber had considered the cumulative burden. Working with his healthcare team, we systematically reviewed each medication. Some were replaced with alternatives, some were discontinued where no longer clinically necessary, some were maintained because the clinical need outweighed the risk. Over the following year, Thomas's cognitive symptoms measurably improved. His neuropsychological testing showed genuine improvement. His family told me he seemed like himself again. Thomas told me nobody had ever looked at all my medications together before. They only ever looked at one at a time. That is the critical insight of number 1. To protect yourself, do these things without negotiation. First, compile a complete medication list, including every over-the-counter medication, supplement, and sleep aid you take regularly, not just your prescriptions. Second, ask your doctor or pharmacist to specifically calculate your total anticholinergic burden using one of the validated anticholinergic burden scales, such as the Anticholinergic Cognitive Burden Scale or the Anticholinergic Risk Scale. These tools exist precisely for this purpose. Third, ask your doctor whether any of your anticholinergic medications could be replaced with alternatives that have lower anticholinergic burden, while still managing your underlying conditions effectively. Fourth, never make these changes unilaterally. Every medication change should be discussed with and supervised by your healthcare provider. Synergy tip for number 1. Share this video with every healthcare provider involved in your care: your primary care physician, your specialists, your pharmacist. Ask each of them specifically about your total anticholinergic burden. The more healthcare providers who are aware of this issue, the better protected you are. All of the research and guidelines referenced throughout this video are linked in the description below. I encourage you to read them, print them, bring them to your doctor. Ask the questions that your appointments often don't leave time for. Here is what I want you to hear as we close. Being on multiple medications does not mean you are beyond help. It does not mean cognitive decline is inevitable. It means you deserve a thorough, careful, comprehensive medication review with a doctor who understands the cumulative effects of everything you're taking together, whether you are 65 or 85, whether you're on 2 medications or 12, whether you've noticed cognitive changes or you're watching this as prevention. This information belongs to you. You have the right to understand every medication you take. You have the right to ask whether each one is still necessary. You have the right to ask about alternatives. You have the right to a doctor who considers your complete medication picture, not just individual prescriptions in isolation. These 9 categories: antihistamines, bladder medications, benzodiazepines, certain blood pressure medications, proton pump inhibitors, certain antidepressants, certain cholesterol medications, sleep medications, and total anticholinergic burden are not areas to panic about. They are areas where an informed, comprehensive conversation with your healthcare team may be genuinely life-changing. Don't let anyone tell you that asking questions about your medications is inappropriate. The research supports informed patients, and so do I. If this video helped you, please subscribe to this channel and share it with someone you care about, particularly someone over 60 who is managing multiple medications. Every week we go this deep into evidence-based health education for older adults, and your support makes that work possible. And now I want to hear from you. Which of these 9 medication categories surprised you the most? And have you ever had a comprehensive medication review with your doctor? Leave your answer in the comments. I read every single one.